Hey there, functional medicine practitioners. There is almost a literal love fest going on with glutathione today, and in most cases, it's probably fine. However, I think we need to be sure that what we're doing and giving is appropriate. So, for example, here is one paper that says glutathione, the lights and shadows in cancer patients. Now, you may think, all right, well, this is in cancer patients. It's not in an autoimmune patient or in somebody with PCOS or diabetes or whatever. And that's true. However, the role of glutathione in the body remains basically the same. And we need to take something, if it's discussed in the scientific literature, even if it's in a population that maybe we're not directly seeing or talking about, and see if we need to have a conversation about the rest of the population. So here's what this paper briefly says. The conjugation of glutathione with xenobiotics means something foreign to the body, includes anti-cancer drugs, which is a xenobiotic. And when the conjugation of glutathione can result in either one of two effects, they say. Xenobiotics, number one, may lose their harmful effects. Now, this can be good or bad depending on the xenobiotic. In the case of an anti-cancer drug, using xenobiotics and losing its harmful effect might be unwanted, because they want the anti-cancer drug to be anti-cancer. Now, all of a sudden, that anti-cancer drug is no longer anti-cancerous. Now, on the other hand, let's say it's a xenobiotic like an environmental toxin. In the case of glutathione conjugation and making it less harmful is a good thing. Interesting. Or the other effect, they say, is that glutathione conjugation may enhance the toxicity of these anti-cancer drugs or xenobiotics by inducing bioactivation. So right now, the conversation should become, well, wait a minute. What is the effect of glutathione conjugation on the variety of xenobiotics that we have exposed to us? Might it make some more harmful and some less harmful? The paper does go on to say, though, and this is highly concerning, is while being an interesting weapon against chemotherapy-induced toxicities, glutathione may have a potential protective role of cancer cells. Well, that should be reason for a little bit of alarm. The paper goes on to say that although self-prescribed glutathione implementation is prevalent among cancer patients with the intention of reducing toxic effects of anti-cancer treatments and potentially preventing damage to normal tissues, now I want to say that they're talking about self-prescription, but there's a whole bunch of functional medicine and nutritional practitioners and health coaches that are recommending glutathione literally to their entire patient population. This belief lacks substantial scientific evidence for its efficacy in reducing toxicity of the anti-cancer drugs. Therefore, the use of glutathione should only be considered under medical supervision, taking into account the appropriate timing and setting. Now, that last part, I think, is what's important. We have this tendency to think that if a little bit is good, then more is better. And if more is better, then basically everybody should be taking something. And in the case of glutathione, I'm just simply going to say, do we irrefutably know that it is beneficial and helpful in every single one of our patients? Do we have lab tests to suggest that? I'm aware of a lot of the scientific literature on a variety of different conditions. I just think that we need to be a little bit more careful when it comes to some of these things, because supplements, unfortunately, do have some negative side effects. If you like this kind of information and want to learn more, check out metabolicfitnesspro.com. God bless.